A very good evening to you. Welcome to another Discourse program on Choice Television with me, Timothy Poleon. This evening we'll be focusing on emergency medical service and some developments which will be occurring in St. Lucia over the next few weeks and months, and those have positive implications for us for a number of reasons. My guest this evening, Mr. Richard Beck, is the Associate Dean of Emergency Medical Service Department of Broward College in Florida, and Mr. Craig Herman, Program Coordinator and also EMS Educator. Welcome, gentlemen, to Discourse.
Thank you. Thank you.
Mr. Beck, what are you doing in St. Lucia at this time, sir?
About 2 months ago, I received a phone call from Mr. Herman over here that I wasn't going to answer. I didn't recognize the area code. I thought, should I or shouldn't I? So I answered it. And it turns out that he was looking for some assistance in evaluating some EMT students that he had, and trying to get together an agreement between his organization and Broward College. So I listened to what he had to say, and it perked my interest because I had done something like this before over in Italy. And next thing you know, the dialogue started, and it progressed into the point of me coming down here to do a meet and greet and to see how we can progress with this agreement.
Okay. But why is it important to have such an initiative in place?
Well, we want to establish a good foundation for EMTs and get them on an even playing field, whether it's in the United States or here. We have a curriculum that's based by the U.S. Department of Transportation. You can do this, this, and this. And if we can get everybody on a level playing field where they can progress from there, people who are in need of EMS services will have a better chance of survival if the education level is brought up to a national standard.
What is happening right now, Mr. Craig Herman, with regard to the qualifications of our EMS personnel in St. Lucia?
Okay. Well, what's happening presently, also from our standpoint, is we have been facilitating this program over the last 8 years, and we were fortunate enough over the last 2 years ago, the head of the UE Open Campus provided the academic environment where we can allow the program to flourish in that type of a setting. And since then, a number of persons have been trained and certified. And that is against the backdrop of 2006, ahead of the World Cup cricket. The Allied Health Practitioners Act was revised, and it saw the emergence of a requirement for emergency medical technician to practitioners in the EMS to obtain licensing in order to practice. And with the program afoot, it allowed those persons the opportunity to obtain those the credentials in order to obtain those licenses. And at present, a number of those persons who have gone through our program have either gained employment with the local fire and emergency services, and others, as anything else, would have gone on to greener pastures. We've had a number of persons who have moved either to the UK to work, even in the US, and others have basically moved on to advance their studies at other universities and colleges in the US. So presently, that is what is with going on with the EMS program or the EMT program locally.
But Mr. Beck, I'm going to tell you that what's the necessity for certification? Some people would have been involved in this kind of exercise for eons, for a decade and a half, and so on. And they will tell you they do not really require the kind of training that you guys are trying to provide them.
Well, we'd like to bring people to a standard. We have what we call the chain of survival. And in that chain, the EMT people and the hospital people, physicians, nurses, and whatnot, work together as a team. If we can get an even playing field with all EMTs so they know how to treat something, when to treat something, how to use their critical thinking skills to a level that they can actually help someone, so when they move them from the field, say, alongside the roadway or in someone's living room, they bring their standard of care to this level, they pass it off to the hospital, which in turn helps the patient to go home to his family or her family. Without that first link in that chain to stabilize and try to decide what the problem actually is, that person may not have as good a chance as if he or she would have, without the EMTs there. So we have, if we have an even playing field at a certain curriculum standard, these folks will know the ABCs of a medicine and how to treat in a logical order.
But Mr. Herman, what are the implications of persons not going through that kind of training?
Right. Well, the implications will be far and wide. One can appreciate that we're dealing with people's lives here, and if persons are not managed properly, you certainly will find a situation where someone's going to lose their life as a result of either not receiving the appropriate care, and if they do receive care, it might have been provided in a rather callous manner, and it can possibly spell a situation for lawsuits and so on. And in bigger countries like the U.S., it's a particular concern. And these larger countries, you get sued easily. So this can very well spill over into this environment. Added to some of what Richard indicated earlier, putting it in the St. Lucian context, the geography of the island is one that we certainly have to take into consideration, where the distribution of your emergency service resources it's not evenly distributed. And a case in point, someone going into respiratory distress, they're having difficulty breathing, and the breathing stops. It's going to take a very short period of time before the heart stops, and once that happens, this person, of course, is in a state we call clinical death, which is there are no viable signs of life. And you can reverse that process with the appropriate basic life support and emergency care procedures such as defibrillation, electric shock to restart the heart. If that itself is not addressed, then within 10 minutes, the brain will die, what we call biological death, if that problem is, and you can't reverse that process. So the whole purpose of getting those persons out there, it must be done within the 10-minute window period, or rather the 46 minutes window period. Otherwise, you're certainly going to have someone who's not viable. And when I say viable, I mean doesn't have a chance to make it. If you think of the geography of the country, you could see how that would be a situation to worry about. Let's just say, take a look at the Canaries ancillary area. Richard will find out a little bit about that tomorrow when we take him down that side. The resources in that area, it's not very well distributed. You don't have a fire station or an ambulance station in the areas of ancillary Canaries. So if you have let's say for example, a resort in that area, and someone goes into respiratory distress or cardiac arrest, it takes an ambulance approximately 25 minutes to get from either Castries to that particular location to provide care to this individual. Likewise, from Soufriere end, it's going to take about the same length of time. And remember, we're working with a 10-minute window period, so it means 25 minutes in one way, and 25 minutes to get back to a facility. That's 50 minutes. So there can be some serious implications when it comes to lives and so on, and we often don't take these things into consideration, possibly out of ignorance, and also possibly out of just not paying much attention to what needs to be done. And that's where we do think a lot about research and development. Yeah.
Quite interesting. We'll take a break. We'll be back in just a moment to continue our discussion. You're watching Discourse on Choice Television.